Welcome everybody. It is 2 o'clock, so we're going to go ahead and get started. We may have some people join after we get started, but that's okay. My name is Lisa Goodpaster. I'm the Associate Director for Project Management here at Carle, Illinois, and I also work with the REACH program. I'm just going to tell you a little bit about Carle, Illinois and our REACH program, and then I will introduce our speakers for the hour. So with that, here at Carle, Illinois College of Medicine, our mission is to educate exceptional physician innovators to deliver high-value, compassionate healthcare through transformative solutions developed at the intersection of engineering, science, and medicine. The Carle, Illinois community is driven by 4 key values that permeate our culture and drive our curriculum, which we refer to as the 4 C's, which are compassion, competence, curiosity, and creativity. As part of our culture, the Carle, Illinois College of Medicine is committed to creating a diverse and talented community of students, faculty, and staff, which is essential to fulfilling our mission. Carle, Illinois actively promotes an inclusive environment in which students, faculty, and staff can learn, teach, research, and serve. This includes supporting and providing opportunities for those that are underrepresented in medicine by having programs such as REACH. The Carle, Illinois College of Medicine REACH program, which stands for Research and Education for the Advancement of Compassionate Healthcare, is an intensive clinical and research immersion summer experience for undergraduate students interested in pursuing a career as a physician. In addition to helping students prepare for medical school, REACH was developed to grow the presence of underrepresented minorities in the field of medicine. For more information about the REACH program, please check out the REACH page on the Carle, Illinois College of Medicine website. And if you've not already, you can sign up through the interest form to be notified of any new information or opportunities about this program. You can contact us at any time through reach@medicine.illinois.edu. With that, we are very pleased to have our speakers today who are both with the Carle, Illinois College of Medicine. Heather Wright is the Interim Director of Curriculum at the Carle, Illinois College of Medicine. She earned her bachelor's degree at St. Ambrose University and her master's degree at Oklahoma State University. In addition to working with the College of Medicine, Heather is a full-time doctoral student at the University of Illinois at Urbana-Champaign. Her research centers on the experiences of underrepresented students in science, technology, engineering, and math. Also with us is Colin Van Orman, who is the interim registrar at the Carle, Illinois College of Medicine. He graduated with a bachelor's degree in information technology from Franklin University. Following 2 years of digital forensics work, Colin earned a master's degree in library and information science with a focus on community informatics from the University of Illinois at Urbana-Champaign. His research interests revolve around access to information, the ethics of information, and information policy. Welcome, Heather and Colin. I will turn it over to you.
Thanks, Lisa.
Great, thank you. So to start things off today, Heather and I would just like to give a brief overview of the session. So we're going to tell you a little bit about ourselves so that you can help frame this conversation. We're going to go through what an application for medical school looks like and the timeline associated with that. We'll go over the process of holistic review and what that actually means. We'll talk about how you can prepare your individual application for medical school. And then we'll also discuss what secondary applications are and how to complete those. We'll spend about 50 minutes giving our presentation, and we'll save about 10 minutes at the end for questions. So if you have questions, feel free to type them out as we go through. Heather and I won't be watching the chat, but Lisa will be. And we'll also be throwing some links in the chat as we go through this, just to point you to some websites and some useful tools that you might want to use. So as Lisa mentioned, sorry, this is taking a second there to load. Heather and I have been working in admissions for several years. So Heather's actually been invited to present at national conferences based on her research around medical admissions. Heather actually also helped develop the Carle, Illinois admissions process based on her doctoral research. So I contribute to this partnership with Heather based on my experience in admissions as well. I've done admissions for master's programs, PhD programs, as well as medical programs for several years. So Heather, I think it would be important to kind of frame this and give a little bit of our backstory as we kind of start this discussion. So would you mind starting off?
Yeah, absolutely. Admissions is a deeply personal conversation. And so I think it's helpful if you know a little bit more about us. So to talk candidly about that, I'll tell you a little bit about my path. So I had a difficult time finding my own path in higher education. And possibly like you, I bounced around several majors. And every time I often was asking myself, am I good enough for what I'm trying to study? So I come from a rural, low-income background. I'm a first-generation college student, and my family is white and Turtle Mountain Ojibwa Indian. So being poor and having a Native background absolutely shaped how I was thinking about the role of academic excellence in my role and you know, what is my responsibility to my family in that. And as a woman, I also felt a lot of pressure about doing all of these things without making it look like I was sweating it all, right? So having that facade to my family that I've got it all under control, I'm gonna help us change our condition, mom and dad can finally retire at some point, right? Like these are the internal conversations, the dialogue that I'm having with myself every day when it comes to picking a major, right? And so some of you might be able to relate with that, but it definitely compounds the pressure. And so I always like to be cognizant of that as we're talking about admissions and thinking and reflecting on my own experience. I know Colin has his own experiences. And so would you mind sharing a little bit with all the attendees today about kind of how you've come to this point?
Yeah, so my lived experience is very complicated, just like Heather's. So I grew up, for all intents and purposes, as a first-generation American with my family immigrating from the United Kingdom. I too came from a low-income household with a single parent. So we never really discussed higher education and going to college because it's nothing my family had ever done. So I really didn't even have any plans to go to college until my senior year at our prom. I entered in a raffle and I won a free class from our local community college. So once I won that free class, I went and I signed up for that one class. And once I got there, I was connected with the TRIO program. So that's really what kicked off my start in higher education. So thanks to the folks in that TRIO program, they really helped me prepare for college because I didn't really know what to expect. I didn't know what college was all about. So in addition to those hurdles, I was also trying to come to terms with my identity during that time. So it really was a journey of self-discovery on how I identified as a gay male and, you know, the experiences that I was going through versus other LGBTQ youth that might not have shared those same experiences and might have had to endure some additional hardships that I didn't have to go through. So I know we don't have a lot of time here, so we can't really explain our lived experiences in such a short amount of time. But I think it would be safe to say that both Heather and I share the same belief that what we're doing here is a way to honor our families through our education. So Heather, could you maybe tell us a little bit more about the medical school application process?
Absolutely. So, you know, I'm going to spend a little bit of time. I'm going to imagine some of you have some of this foundational knowledge, but not everyone has access to the same information. So we kind of want to level the playing field to begin with. So first we're going to talk about the AMCAS. So what is the AMCAS? The AMCAS is the American Medical College Application Service. This is the common app or the central app that you're going to use to apply to every medical school in the US and Canada, with the exception of the medical schools in Texas. Texas utilizes its own application system. So AMCAS is that common app. The components in the AMCAS are going to be your kind of basic biographical information. So, you know, your address, your permanent residence, questions about your gender, where you went to school, transcripts, family income. It's going to ask questions about some of the leadership experience that you'll have. We call those meaningful experiences. You get to submit 15 of them. We'll talk about it more in detail in a little bit. It also has a section for you to share a personal statement. What I'll say with the AMCAS, and again, we can go into this in detail later, and if you have questions, I really welcome you're using the chat feature to ask questions about the AMCAS. But where I see folks struggle sometimes is that there is this paragraph on overcoming disadvantage that goes into your AMCAS. And if you're anything like me, again, when I was applying to undergrad, I felt some shame in being a first-generation college student. I didn't I wasn't at the point I'm at now where it's like kind of this badge of honor. But at the time I was worried that there was a stigma around it, or what would individuals think if they knew this about me. And so I'm glad I've grown past that, but knowing how to articulate that in an application and what aspects you share forward in that can be very, very difficult. And so again, you don't have to share your whole story. You know, you can kind of code it and be guarded in that. But if you have questions about that portion of the AMCAS or how to write about that, make sure that you're sharing those so we can answer them later on. So next, we're going to talk a little bit about the timeline and what does that, when do you fill out the AMCAS? What is a successful student doing and at what point in time? And we know you all are going to have different experiences. There are some of you who might be sophomores on this call, and so you can follow this time kind of this timeline in lockstep. There are others who are maybe entering their senior year and that timeline could be different. So this is a general rule of thumb, but Colin and I are going to walk you through what should an AMCAS timeline look like.
Great. So with this timeline that you should be able to see here on the screen, we've broken this out as 2 years out, 1 year out, and then your actual admissions year. So kind of frame it like that. So it could be applied if you're still in school, or you can use it if you've already graduated and you're just looking for a little bit of extra time to kind of plan out your process. So we'll go over some of those bullet points that are up on that 2 year out section, but the one that I want to touch on first is planning your finances. So applying to medical school is a very costly endeavor. For the AMCAS application itself, that common application, it costs $170 just to fill out and submit the application to a single school. For each additional school you wish to send it to, it costs $41. So that adds up very quickly based on the amount of schools that you're going to be applying to. So Heather and I were actually talking earlier and we just confirmed, but on average, most applicants are applying to at least 16 medical schools each cycle that they apply. So that's 41 times 16 plus the $170 base fee. So in addition to the application itself, you have to take what's called the MCAT, or the Medical College Admissions Test. That test costs $320 for each attempt. And really the purpose of that exam is to ensure your competence in the foundational social sciences that you're going to need for medical school. On average, for those folks who have been accepted into medical school, they score around a 510 or a 511 on that exam. So a little bit later on, we're going to share a chart with you on MCAT scores and showing where you might fall in what percentile. So you're probably
can
saying
I ask
to yourself,
you a question?
Yeah.
Well, can I interrupt and ask a question? So what happens if we take the MCAT multiple times? Like you said, it's going to be $300 and some per attempt, but how do medical schools look at people who take multiple attempts on the MCAT? And how do I know I'm ready?
Yeah. So that's a really good question. So you honestly don't want to be taking the MCAT more than once, if at all possible. So yes, you might take it and you might not score very well, but you shouldn't be taking the MCAT until you're ready. So you want to complete some practice exams. You want to check out some books from your library that walks you through preparing for the MCAT. There's also a really good resource through the Khan Academy, which I'll throw in the chat here, for their MCAT test prep. That's free online, but if you're interested in that, you'll want to jump on that now because they're actually discontinuing that program in September of 2021. One of the other things that you might consider is if you qualify for what's called the Fee Assistance Program, or the FAP, through the AAMC, it provides quite a few resources that you might find of value. So some things to know about this is that you need to apply for the Fee Assistance Program before you start this entire process, because nothing is retroactive with it. So they won't give you money back for anything that you've already signed up for. And at this time, the Fee Assistance Program is only available to US citizens, permanent residents, or DACA recipients. So if you don't fall into one of those categories, you likely won't qualify at this time, but you can always check out their website to confirm. But with the Fee Assistance Program, you actually get access to a free MCAT official test prep bundle that's available online. They reduce your registration fees for your MCAT exam from $320 down to $130. You get access to what's called the MSAR, or the Medical School Admissions Requirements, which is really useful for generating that school list as we talk about being 1 year out. It completely waives your AMCAS application fees and lets you send it to 20 schools free of charge. So it's a really, really powerful tool. So one of the other things that I see up here that we need to talk about is letters of recommendation. So I know, Heather, when you were applying to graduate school, you know, you kind of had some challenges as you framed how to ask for those letters of recommendation. So would you mind just kind of talking to the group about that?
Yeah, so I don't know if anyone else on this call has felt like it's super awkward and you don't know exactly how to utilize office hours. But in general, I would say that that's probably a little bit of fear, imposter syndrome that's talking if you don't know how to go to the office hours. So the best rule of thumb, and now that I teach undergrad classes as well, I really can't underscore how important it is to just show up, be your honest self. And if you're saying, I'm struggling in the class, but I don't know what to turn to next, or I'm struggling and I don't know the best way to prepare for office hours in order to maximize this experience, can you please give me some guidance on that? The faculty are going to be happy to do that. Like that's literally, they had a choice. They could choose to research and teach at a university, or they could have gone to private industry, and they chose the university environment. And they chose that for a reason. And it's typically because they like working with students. So go to the office hours, because that regular relationship at office hours can make that request to write a letter of recommendation for medical school so much easier. For one, they have a better sense of who you are, but two, there's some rapport there. And so it doesn't feel as transactional when you have to ask for the letter. If it's too late in the game though, and you're at a point where you need to get letters, but you don't have that relationship, I would say it's never too late. You can still try to kind of court and give attention to that dynamic of that relationship. So some pro tips in asking for that letter of recommendation, if you don't have that strong rapport, even if you do, is the AAMC has this guide for letter writers. This is this kind of the various components that admissions offices are looking for in the letter of recommendation. So Colin just dropped this in the chat, but print this out or have it electronically and bring it to the faculty member. And so they know what areas they need to touch on for you to get a high quality letter of recommendation. The other thing that you'll want to do is to prepare your resume or CV. Now, people often ask the difference between the two. CVs are more academically driven, right? And I would say most people don't really need a CV until grad work, like master's and doctoral level, because it's rare as an undergrad that you have the kind of research output that would kind of say that you would need the CV. So you'll likely have a resume. So prepare that and have that with the letter. Sorry, I feel like we got it. Sorry, hope that's not the Rona. I think it's just an asthma attack. But, so I apologize for that disruption. Oh, sorry, and I just coughed in the microphone. So sorry. But go with your resume. You want to try to call out the specific areas that the guide for letter writers are looking for. So for instance, I was an RA in college to both pay for housing and for the leadership experience. So that would really kind of complement the interpersonal attributes section that the letter writer should talk about. So I would make sure that my letter writer knew that I had this leadership experience. So it's kind of making it easier for them to write the letter. It's also, you're going to get more out of it because you're kind of coaching them into what they need to write.
Heather, there's kind of a few questions that I'd like to throw in as you talk about these letters of recommendation. So What about folks who have been in industry for a while? So they've been out of college, they're not in college anymore. And then how many letters should, applicants be asking for? How many do they need for their application?
Yeah, you're going to need toughies. So you need a minimum of 3. Most would say a maximum of 5 letters. If you're in industry, it's okay to have someone writing a letter for you, a supervisor writing a letter, because they're going to talk about your professionalism, right? They're going to talk about your timeliness, your ability to work well in teams, being self-directed. So these are valuable attributes to highlight. But look at each medical school individually because they're going to have different letter writing requirements. There are some who will say you need to have 2 letters from the basic sciences, 1 from the social science, and 1 from an other category. So make sure that you're kind of falling into those. If it has been years since you were at that institution and the faculty no longer work there, you don't have a letter from them, then I would say the safe thing to do is work with that medical school specifically, letting them know what your unique circumstances are. They would likely have to take that to their admissions committee to vote to amend those requirements, but you won't know what your options are until you ask. So it's okay to ask the question, and it's okay to be persistent in asking. If an admissions office hasn't gotten back to you within the business week, feel free to send another follow-up communication.
Cool, that's really helpful as it relates to letters of recommendation then, Heather. Maybe you could tell us a little bit more about generating that school list and then what a personal statement is as it relates to these, unless there's something else you wanted to touch on.
No, I think that's great. I mean, the only other thing I'd say about letters of recommendation is some people are worried because some undergrad institutions do committee-based letters and some do individual letters. And so I would say you're not at a disadvantage if you don't have a committee-based letter. They're both valuable. They're just interpreted slightly differently, but you're not at a disadvantage. So if we're looking at the timeline and we look at the 1-year mark, you'll see there's that section on generating a school list. This is where I think it can be really tricky because it's obviously expensive. If you qualify for the fee assistance program, most medical schools are going to waive some of their individual expenses. So we'll talk about that more when Colin and I talk about secondary applications later, but that's something to be cognizant of. Is when you're generating your school list, it's also kind of going to be driven in part by cost. So that's one thing to think about. I also want you to think about, as you're generating a list of where you're going to apply, you have to think about your citizenship status. And so if you are undocumented, there are still medical schools you can apply to, but it's going to be harder to narrow down that list. There are some great resources I'm happy to drop into the chat to support dreamers in that path as well. So I think it's good to know there's still options for you, but it's more narrow. The list is more narrow. The other thing to think about is there's a different admissions standard, and I'm going to show you the admissions formula, kind of the algorithm that medical schools use for admissions, but there's a different admission standard if you're looking at a public medical school and it's in-state versus a medical school that is out of state. And so it's good to know that there is that difference. So I'm gonna mute myself for a second and let Colin take it because someone is at the door and I'm so sorry. I'm so sorry.
No, it's fine. I'm happy to take over from there. So one of the things that I do want to mention is kind of moving on to these personal statements. There are so many resources out there as it relates to personal statements. I'm going to share one that helps you craft that from the AAMC, which is the Association of American Medical Colleges. And they'll walk you through kind of what a personal statement should look like. One of the biggest tips that I could give you around personal statements is that you want to have someone professional read it over for you. You shouldn't write it in isolation and then hope that it turns out well. You really want feedback because you're going to be making multiple iterations of a personal statement.
And I'll just tap onto that. The easiest formula to follow for a personal statement for medical school is not making it overly medical, right? Because while you're applying to medical school, not everyone on the admissions committee has medical experience. They may be more higher education professionals. So instead I would focus more on the beginning, middle, end of your kind of life story. So what sparked your interest in medicine? That's kind of your beginning. The middle is what kind of attributes are you looking for in a medical school? And the end is what kind of physician do you want to be? What do you want your practice to look like? So that's one quick formula you can use. It's not the only one, but if you're struggling in structure, that's one appropriate and professional way to structure your personal statement. Okay.
And then what about interviews? Because we're going to talk more about that AMCAS application and that secondary application in a few slides. So could you tell us what to expect with interviews? Are there costs associated with that? What are interviews structured like? Things like that.
Yeah, so I would say these are some of the hidden expenses that are in the admissions process. Because we've talked about there's this upfront cost to medical school in the AMCAS application and sending it to each individual school, but there's this additional cost for secondary applications, and there's this another cost for going on interviews. So with interviews, there are a few components. Almost every medical school in the United States requires an in-person interview. Carle, Illinois is one of the few medical schools that still does not require an in-person interview. And there are many reasons why, and I'm happy to dive into the literature if people have questions later on why we don't interview. But what you can expect from an interview is either kind of a behavioral interview, right? So they're asking you questions about, tell me about a time where you demonstrated leadership, right? And so this is like in a small panel. And so it's kind of an informal, semi-structured environment. The other type of interview that you could experience is called an MMI. It stands for multiple mini interviews. So this, you're kind of set up in a circuit. You're going to do multiple, like short little bursts of interviews in multiple rooms. And they use inter-rater reliability to determine your performance on how you did in these interviews. There are other assessments that can be tacked into this. So like CASPER is a situational judgment test where you're going to do a multiple choice kind of quiz at home. And there's this extra cost in there where there's the cost to initially take it, and then it's another $10 to send it to every medical school that requires it after that. And so all of that is aiming to learn more about who are you outside of a standardized test taker. That's what the intent is behind that structure. So interview season is often rolling, meaning that it starts in September. It's often in kind of in lockstep the timing that you submitted your application and can go all the way through spring.
Great. And then I just want to touch on two other points as we look at that final line for the actual admissions year. If you're given an offer of admission to a medical school, typically you'll need to commit and say that you're going to attend that medical school in mid-May. It just depends on where you are and if there's a wait list and things like that, but typically that's the deadline for most places. The other thing to keep in mind is that most medical schools will start in mid-August, but there are some places like Carle, Illinois that start as early as July. So that can really shift from medical school to medical school. So kind of moving away from this timeline then, I think it's important for us to discuss what holistic review is, what it means, and then how that's factored into scoring you as an applicant when you apply. So as you can see here, this is the AAMC's holistic review model kind of wheel that they have here. So you can think that holistic review is an admissions process that considers you as an applicant individually, and it balances all these different areas, your academic metrics, your experiences, and your attributes. So they use this combination to view you as an individual and not say that you're just made up of your GPA or you're not made up of your MCAT score. So the AAMC publishes a lot of information on how the MCAT scores can be used in the admissions decision. So I'm going to share a guide about how they actually use that for admissions here in just a second. But I will say that the experience section, which you can see at the top of that ring, is something that really helps the student affairs folks, because the student affairs folks are the people who are supporting your well-being as you go through medical school. Know that if you were able to balance everything as an undergraduate, then that there's a very good chance that you'll be able to balance everything in medical school as well. The attributes section are really just these 16 characteristics that medical schools overall agreed were very important in helping us to determine who would be a good applicant at our school. And then the last one is that metrics section where Heather just shared the link for that. So some really interesting items to note from that document that Heather shared are going to be on page 12, where it talks about an MCAT score change. So earlier when I mentioned that you really only wanted to take an MCAT once, if you look at that score change on page 12, you'll see that there's not a lot of wiggle room from when you take the exam the first time versus when you take it the second time. Your score is not going to go up or down that much. So that's why it's really not a good idea to try and take it multiple times. On page 16, there's a really good call out that shows medical schools, how they traditionally admit students based on their MCAT and GPA. And Heather talks about that on the next slide and why those metrics are important. But really the higher your MCAT score and the higher your GPA, the higher likelihood that you'll receive an acceptance offer to a medical school. And then the last item to kind of note from that handout is on page 28, and that talks about how MCAT scores in your GPA can be used as a predictor for you to progress through your first year of medical school without delay. So I do want to go ahead and hand it back to you, Heather, if that's okay, so that you could maybe talk about how we use this holistic review to actually score applicants.
Absolutely. And if I start coughing, I apologize. I have a nasty asthma attack happening right now. And so I've taken my inhaler, but I apologize if I start like wheezy central over here. All of this comes together into a total score for the application. And so this is kind of the secret sauce. These are the things in medical education that it's a little bit harder to find data on this, but you can thank my dissertation for trying to track all this information down for you all. So this is data based on public medical schools from 2010 to 2017, and it looked at what is the algorithm that medical schools are using in admissions. And so what you can see is that over half of the decision comes from what we call cognitive measures. So these are, it's a value that's calculated based on your MCAT and your cumulative GPA. There are so many questions that could come from this, and there's a lot of variation that comes out of this. Sometimes they use subscores of your MCAT, right? So they'll just use one portion to see how did you do in this one subsection. Other times they will weight your GPA based on where you went to undergrad. So there's this thing called the Carnegie classification of higher education. It tells us the different types of institutions and that where they put their work and the alleged rigor of that work. And so if you come from a research institution, sometimes they will offset your GPA slightly with the thought process that this is a more rigorous institution. I use this lightly because there's actually not a lot of research and evidence that supports that kind of practice. The other thing that we think about with GPAs and MCATs is sometimes they can also be modified based on what is the mean performance of individuals who attended your institution. So that is meant to be an equity initiative where if you were a really strong MCAT performer, but from a school where individuals who went to your undergrad did not perform well, it's trying to say that you were at the top for that comparative cohort. That is not used as frequently in med school admissions, but it is to know that that sometimes exists in individuals' calculations for total points. So what you're seeing on that one kind of more than half of the decision is that it's coming from your cognitive index, this cognitive measure. What's in blue, or about a third of that pie chart, is what we call a non-cognitive measure. So these are things like your lived experiences, your diverse background. They can be academic awards, like did you do research and did that research have a publication? Did you have any honors from that? Within the realm of diversity, it's not just sexual identity, gender, race, which are all rural status, right? These are all diversity identifiers, kind of like that holistic review wheel, because really this blue third is talking about that holistic review wheel. It's just that most of the time we operationalize this, we turn it into rubrics or scoring mechanisms by which we can then evaluate the applicant. But diversity can also mean, did you use another language in like a clinical environment? So can you show us that you are going to serve a broad patient base? It is very important that medical schools continue to think about the role of diversity in admissions. And you may be asking yourself why. There's so much data that backs this up. We know that underrepresented physicians are more likely to go on and serve underserved communities, right? We know that underrepresented patients are more likely to comply with the care plan when it's prescribed by an underrepresented physician, right? There is so much historical trauma, systemic racism that is still alive in our system today that we have to dismantle that. And so part of that means we still have to consider multiple diversity factors in the admissions process. And so that's why medical schools still look at diversity in admissions. We also look at things like community service. And so have you had leadership roles? Did you volunteer in a community program? Did you volunteer in a hospital? So these are the types of things we're looking at. Another insider tip that many of you all may not know is that community service can look different, or it has a few different buckets. So one bucket of community service could be volunteering within the community, but another bucket is volunteering within the hospital. And then sometimes that gets conflated because people are like, oh, well, I shadowed a physician, so does that count as volunteerism? It does not. Volunteerism in the hospital is things like, are you helping with wayfinding? You know, were you making beds? You may not think that this is as medically relevant, but it's understanding the healthcare system. It's getting that primary exposure, and so it's highly valued. If you were like me, there was no way that I could have afforded an undergrad to get hundreds and hundreds of volunteer hours because I had a financial obligation for myself and my family. And so for me, I got my CNA. I worked in a hospital all the way throughout college to help supplement my, my financial aid. And so you can put in work experience like that. And if it's work in a clinical environment, fantastic. Like it's very clear if you have a financial need and you're building your experiences, there's an understanding if you can't get all that volunteerism in. So that's an important thing to acknowledge. We also know COVID-19 is really throwing a wrench in people's clinical service and volunteerism. And so there are other ways that we can talk about at the end if you're trying to show that you have this passion and interest and you have this heart for service.
Heather, can I?
Oh, yes, please.
Oh, sorry. Yeah, I was just going to say, I do have some questions about those cognitive measures, but if you were going to say something else about the non-cognitive measures, I can let you finish before I interject.
No, I was actually going to talk about interview scores and in-state status. So why don't you go ahead and take me back to the question.
Yeah, so moving back up to those cognitive measures, you know, since I went to a community college, could I have used the science classes that I took there towards my application for medical school, or do those not count?
Love the question. So almost like everything I have to say, make sure you're double checking with, if you have a dream school in mind, go to that dream school's admission standards and think about your application through that context. But the general rule of thumb that applies to more medical schools than it doesn't is if 51% of your science credit is done from your degree granting institution, it doesn't matter if you've taken multiple community college courses. It does not matter. You know, they understand if, you know, you're taking like, I don't know, in the summer, you're like, okay, I want to get biochem done because I want to get one of my hard sciences done outside of the normal academic year. That's understandable. It's fine. On average, we see about 3 or 4 community college science courses in the admissions process. Like that's not abnormal to see on a transcript. It is rare if a medical school will not accept any of your community college courses. I've only seen that one time, and it was a very prestigious institution. And so I think that they had certain assumptions in place that I think are probably not the most appropriate, but that was that one policy. So generally, yes, community college courses are fine.
And then what about AP courses? So if in high school I had the opportunity to enroll in an AP class, can I use that as part of the admissions process? Are AP classes not counted? Does it depend on the institution?
Yeah, I would say most of them, it is accepted most of the time, because most of the time your AP are in those entry-level courses, and so you're going to take the successive course afterwards. So for instance, I may AP Chem, take AP Chem, but then when I go to my degree granting institution, I'm going to take biochem there or an advanced chem, P-Chem. And so if you're taking the successive course at that institution, it's fine. Where I typically see folks struggle with AP is that they don't have enough lab credit hours. So you just want to make sure you're auditing to hit that average number of lab credit hours.
Cool, thank you. So
Yeah.
I do want to go back to that last part on this pie chart that you're talking about. What does that in-state section mean?
So in-state is referencing if you're applying to a public medical school, because they derive some of their funds from state tax dollars, they set an admissions goal of admitting so many in-state students. So typically those admission standards, you may, I'm going to say it takes 100 points to that's a max point value. I'm making this up right now. This is just for example. So if it's a 100-point scale, they may say the admission standard for an Illinois resident is a 90, but for an out-of-state student, it's a 93, right? So they may set a different standard for an out-of-state student because the goal in part of their state mission as a public institution is to admit within state. Private medical schools do not use that in-state, out-of-state predictor, and so their algorithm looks slightly different. This is all based on public medical schools because you can FOIA some of their records, so it's easier to get their admissions data than it is for private medical schools. Interview scores are kind of that last piece that usually it's that you qualify for admission first, and then the interview is kind of, does it tip the scale? Does it help the student get in? Unfortunately, we sometimes see medical schools offer more interview spots than what they would really admit, and that's some unethical practices. But you know, you can always ask a medical school, how many interview spots do you give relative to the number of offers that you make? They may not give you that data, but you can absolutely ask for it. It's not an inappropriate question.
Great. And sorry, just to be cognizant of time here, do you mind if we go ahead and move on to the next section and you can maybe give us a few tips on how to fill out our AMCAS? Okay.
Yeah. So I'll be super quick here. The thing to know about your AMCAS is just to understand there are multiple tracks you can apply for. So there are BS to MD programs, so straight undergrad track programs. That would almost need in its entirely own webinar if we were to talk specifically about BS to MD tracks, because the sequencing of things and how you show you're prepared, it's just very different. I have advised students through that process. So, you know, possibly one-on-one later, we can answer those types of questions. But you should know there are, there's MD, MD, PhD. The benefit of an MD, PhD is that oftentimes those are tied to funding sources. So both are funded. So if you have that heart for research and you're really, really interested in being a researcher with clinical skills, that might be an avenue. Again, that could be its own webinar, but I want you to know that that track exists. There are also thematic curricular tracks. So there are things like global health or urban health or rural health that can be woven into a program. And then there are combined degree programs like MD, MPH, MD, MBA. So there are these dual track programs that exist as well. The things I want you to think about as you prepare your AMCAS is do not use acronyms. I see this happening all the time on applications. So a student will be like, oh, I'm in an RSO at UIUC. So what that really means is a registered student organization at University of Illinois. But you become so familiar with those acronyms, the people that are scoring your application are not as familiar. So really, really, really break it down. So I'm a member of SACNAS, for instance, the Society for the Advancement of Chicanos and Native Americans in Science. I need to spell out what that acronym means. I cannot just call it SACNAS, so be cognizant of that. My other tip is identify a mentor to review your application. This individual should have an advanced degree, ideally, and you want them to go over not just for grammar, but that the flow is there, that the substance is there. I think that, you know, my parents, while they don't have advanced degrees, they're, you know, they're intelligent, loving, highly capable people. But I also know that to apply to medical school, that's just a very narrowly tailored skill set. So make sure that you're aligning with the right mentors to review your materials. I mentioned earlier that there are up to 15 experiences that you can submit on your AMCAS. These are things like the volunteerism, the work experience, research, awards, right? So you have up to 15. I see students that are just, man, they're failing themselves because they're only going to put 4 or 5 or 6 things on there because they don't know what to list. Use a minimum of 12 experiences. If you can fill all 15, fill all 15. Some people will say, don't just fill it to fill it. I would say in years of doing this, it is better to put more than less. And something you could start working on now is really focusing on the personal statement and preparing that now, because you would not believe, you know, the average AMCAS is going to take you over 15 hours to fill out. So this is a very lengthy application. So if you can knock out the personal statement now, it's just going to make it that much easier for you later. And then the last thing I'd say is there are a lot of for-profit companies out there that are going to try to charge you to review your AMCAS application. Do not fall into that trap. There are many resources likely at your institution that will review it. And if they do not, then reach out to us at Reach and we will connect you with resources to help find that. Okay.
Great. So the kind of last point that I want to talk on today is going to be about secondary applications. So secondary applications are going to be these follow-up applications after you submit a primary application to an institution. So what I'll say, the more ethical institutions that send you a secondary application will actually do some sort of cursory review before they send out a request for you to complete a secondary application. But then there's other institutions that just send it to absolutely everyone that applies to them. So secondary applications often have a cost associated with them, usually around $100 for a lot of places. Here at Carle, Illinois, we don't charge for a secondary, but we also do screen. So we want to make sure that folks that we're sending a secondary to are qualified for our school, and we're not going to ask them for additional money, but that's not going to be the same everywhere. So kind of the biggest piece of advice that I can give you about secondary applications is that you don't want to fill out every single one that you receive. You need to pick and choose where you want to complete a secondary application from. The other big thing is that a lot of secondary applications don't have a deadline associated with them. So the general rule that you need to keep in mind if you are given a secondary application is that you have around 2 to 3 weeks before you should be filling that out and sending that back in. There are going to be some institutions that do give a hard deadline, but if there isn't a hard deadline given, you really need to aim for that 2 weeks, no more than 3 weeks, to fill out the secondary application and submit it. One of the other big things to kind of keep in mind with secondary applications is that they all use similar questions. You're not going to have the same questions from all of them, but here are some questions that you're going to see on a secondary application. We pulled these from Medical School HQ, which is this wonderful resource that lists off quite a few secondary application questions from prior cycles. So it's not a guarantee that you're going to see these questions again, but it gives you a really good idea of what institutions are asking for. And since we are kind of short on time today, I will say that Heather, she's not going to tell you this herself, but I'll tell you it on her behalf. Heather did a podcast where she talks about the secondary application process. So I'll throw that in chat. So if you want to learn more about secondary applications and what they're all about, go ahead and listen to that podcast episode. And it's just like listening to Heather now. So kind of based on time, Heather, we have about 3 minutes before we need to hop on over to questions. Did you want to share any other thoughts, or do you want to go straight into questions now?
Yeah, there are a few thoughts, and the slides will be available later, but there are some essential pieces that we're not going to have a chance to talk about in detail, but I want you all to know about. And so one of them is the role of standardized tests, what that means for what we call the match, and what your career aspirations are. Because this is one of the things that I think breaks my heart the most in working with enrolled medical students is if you're not coming from a multi-generation physician household, you may not know about the USMLE, which is this national board. Well, it's medical licensed examiners, right? And so there are kind of levels of board certification that you take, these multiple choice tests, and how you perform on those can impact what type of specialty you may want to go into. So you may say right now, like, I want to be an OB-GYN who specializes in reproductive endocrinology. I mean, I have no idea, but maybe that's what your interest is. Depending on how you do on your licensure exams, it can impact your ability to match into that area. And so the match is this entirely other talk that we could do. There's lots of stuff online that you could read about the match, but it dictates kind of where you go for your training. So just getting the MD is not enough. You then need to go on to complete residency to practice medicine. And so I love, if you have an interest now, like, I want to be a plastic surgeon, like, good, like, run with that passion, let it fuel you. But also be aware that getting into medical school is really just the first step. Then there's all of these steps that are going to come with medical school. And don't let those overwhelm you. Don't let you tell yourself that you're not going to get there because of that. But know that that landscape exists so you know how to navigate the terrain successfully. And there are so many resources in medical school once you get there that'll help you along that way. But knowing that that standardized test is going to follow you, knowing that the match will kind of dictate where you'll live and what you get to practice, those are important things to know for you to be well informed, and so you can make an informed decision when you apply to medical school. So those were the kind of the last little bit that, like, if I were to tell you to keep hunting for more information, those are some areas I want you to keep hunting. There are some action steps that we have outlined, and so Colin can share those with you all on kind of what your next steps are, what you'll be tasked with doing. And if you all don't, it looks like a bunch of questions have come in, but if not, I have some of the tricky questions that come forward, which are usually things like, I got a ticket for drinking my sophomore year in college, and I don't know how that's going to show up when I apply to medical school. Or what if I did a post-bac, and what does that do to my GPA and that admissions algorithm you showed earlier, right? So I have all of these like really tough questions that we have answers to as well if that comes up. So anyways, Colin, take it away with action steps.
Yeah, so let's just kind of plan out for a few things that you can do immediately after you kind of finish this session. I think it would be really important and helpful if you look for a medicine or medical related podcast. One of our favorites here at Carle Illinois is the Pre-Med Years, and they have a plethora of episodes that will talk about the admissions process as well as what it's like to be in medical school. So that's a really good resource, but there are other great podcasts out there. If you want to try and prepare for medical school, one of the best resources that you can get as you prepare for the MCAT is this book called Make It Stick: The Science of Successful Learning. Almost every library will have that, and if they don't, you can request it through a librarian there. That would be a really good book for you to check out to kind of help you prep for taking these standardized exams. And then one of the other things that we really like are some of these different groups on Instagram because they show some identities that we don't encompass within ourselves. So it really gives you a way to get a perspective on medicine from someone else. So two of our favorite groups are Black Men in White Coats and Women in White Coats. So those would be two good Instagram accounts to take a look at if you're interested. But again, there are many, many others out there. So with that, I just want to say thank you from both Heather and I. We've shared a link where you can find the recording of this event. But then we'll also go ahead and start fielding some questions from the chat now.
I'm going to go back to answer some of the ones earlier, if that's okay. Someone asked, do we have to ask questions during our interviews? And if so, which questions would be best to ask?
That's a great question. I think part of it's going to have to be based on what is your interest. So for me, I would be really curious to know about the various patient populations that they serve, the diversity of type of clinical practices where they're at. So are they only at one hospital, or are they at multiple clinical sites? I would be asking questions about the cost of attendance and financial aid packages. I would be asking about average length of study, program tracks. There's this group called the LCME. It's the group that accreditates, it's the accreditation body for medical schools. If you're really bold, you could also ask, have you had any citations from the LCME, and what action steps is your medical school taking to follow up on those? You could ask about their strategic plan, wellness support for students. I mean, it really has to be based on some introspection on your part of what do you need to be successful in medical school, kind of trying to anticipate that and asking questions around that. And that's where I think listening to some podcasts or following inspirational folks or people who are just going to be really candid on like Instagram and different social media platforms, is it starts cluing you into more of like, what is the day in the life like? So you're better informed on kind of what you might need when you're in medical school. So.
What do you think about gap years? Should we use one?
It's a loaded question. So I don't know if Colin wants to answer it, or if I mean, I'm happy to take a quick pass if you want.
I can start. So
okay.
I think that gap years can have a place. It depends on the kind of introspection that you're doing as an applicant. So perhaps you decide to apply for medical school and you don't get in on that cycle. It's okay to take a gap year, but use that gap year to supplement your application to make yourself a stronger applicant. If you spend that year not doing anything, then it's not really worth it. So you should look through your AMCAS application and see where there are deficiencies. So do you need to, work on some volunteer experiences that you don't have? Do you need to do a little bit of shadowing? Like, what are you going to do with that year? So that would be my recommendation for gap years. They do have a place, but you need to make use of them. It's common for folks to take a gap year, so it's not something that's looked down upon within the admissions process. So Heather, was there anything else you wanted to add there?
Yeah, I think it's part of that introspection that you're mentioning. A lot of times when I hear people taking a gap year or doing what we call a special master's program, so like some of those 1 or 2 year master's programs, sometimes tied to a medical school, I have real mixed feelings about it, but I think you have to know where you're at and let the data make that decision with you. So Colin shared a link earlier on kind of MCAT and GPA performance as it relates to probability of matriculation. If it is very focused, like I have to do better on the MCAT, then be really intentional in that gap year about building that plan. But the hard thing with a gap year is you don't have a lot of time from the admission cycle to make a significant change. So if you're planning going straight from undergrad, then gap year, and then going to medical school, remember you're applying in that summer between senior year and the gap year. So you will not have taken any of that action of the gap year yet. All you're capturing is the summer after senior year. So you may give yourself a few more months, a month or 2, maybe 3 months to study up for the MCAT. So in that sense, if that's a gap year is helpful, then do that. But I don't know, I think gap years can be most helpful if it's for mental health and wellness, because then you can really nurture your soul that way, or you can go do something fun or work to save up a little money for medical school. I don't know, like it could be, you have to know why you would need a gap year, but most of the time I think people are doing it because they're nervous about their GPA or MCAT, in which case then let's target that as the actual source of the problem.
Thank you. Is it true that California does not follow in-state requirements?
It depends on what California medical school you're looking at. So I would look specifically at California, like at what institution in California. I will say if you want to do residency in California, it is going to be much better for you to do undergrad med ed, which is what we would call medical school. Right, it's confusing. We say undergrad, you think it means your baccalaureate level, but it's not. Undergrad med ed is the 4 years of medical school, and then grad med ed is residency. So if you want to do grad med ed in California, you should try to go to undergrad med ed in California, because there's some data that shows that you have a higher probability of getting a residency spot in California if you did your undergrad med ed there.
I'm a senior in college and my GPA isn't competitive for medical school. Are there any recommendations besides postbacks that can help my GPA, such as taking more upper division science courses?
Do you want to?
So I'm going to jump in for the first part of this. No. I would say that keep in mind that your GPA isn't what defines you as a person. That's just one factor in this holistic review process. But I would say be realistic about it. If you look at that MCAT and GPA on medical school acceptees that we shared with you, and you scored a 496 on your MCAT and your GPA is a 2.5, the odds of you getting into medical school are very, very, very low. And spending extra money and doing a postbac isn't going to help you. That's not the way to get into medical school. So you need to look at other areas that you can improve to make yourself a stronger applicant, or decide if maybe another area of medicine is for you. So you don't have to be a doctor to work in medicine. There are great folks who aren't doctors but do research. We have some great nurse practitioners, some physician's assistants, things like that that we work with. So there are other avenues that you can always pursue instead of just being a doctor.
Yes, sorry, I got distracted because my husband just walked in. The other thing I would say as it relates to GPA is, make it data driven because it is relative. When you say you don't have a competitive GPA, like what does that really mean? Like you don't have to put it in the chat box, but I would challenge that. Sometimes I hear someone say that and it's like, well, you have a 3.2, like that's not competitive. Like you should be proud of that. And so, you know, it can be very relative. I think there was a second part of that question, maybe, was there, that didn't get answered, maybe not?
Just as we're taking more upper division science courses, would that be something?
Oh, yeah. So what I would say about that is all of those upper division science courses, when you look at how many credit hours you've already amassed, taking 4 or 5 upper division science courses that are maybe 4 credit hours each, run the numbers. You could get 4.0s in all those. It's not going to make a huge dent in your GPA because it's already amassed so many credit hours. So in there, I would focus on trying to improve your MCAT over changing that GPA because it's going to be an uphill battle to change that GPA. I would say that in that specific instance, maybe a master's degree could be helpful because it'll give you another data point. But that's a huge maybe, and there's so much financial cost associated with that you really, you need to sit down with the coach to go over your whole application. If your undergrad has pre-health advisors, go to one of them. If not, reach out to your state medical school and see if anyone in their admissions office will meet with you for even a 20-minute review. And you go in really focused and prepared. Come in with your transcript, what your BCPM GPA is, that biology, chemistry, physics, and math. I think it's NYU has a great BCPM GPA calculator. So if you don't know your BCPM, you need to look it up because that is a component of your GPA that's important in med admissions. So run your BCPM, have your transcript ready, list out what your 15 meaningful experiences are, create a summary sheet. And so when you meet with that admissions officer, you can say, okay, here's where I'm at. This is where I'm at with MCAT or practice MCAT scores. This is my GPA. I have X amount of clinical volunteering. I have X amount of research hours if you did research, right? Like create a quick summary, give it to them and say, what do you think? And then don't accept just one answer. Try to, get a second opinion. So ask another medical school in your state if they would do the same 15-minute consultation with you. This is the second medical school that I've worked at, and both ones we would do that for free for applicants.
I want to be cognizant of time. We do have other questions, but Colin and Heather, we can answer these offline, or do you want to keep answering? I will leave that to you.
It is Colin's call.
Yeah, I actually won't have time. I need to wrap up in the next few minutes. So I think we would be happy to try and tackle some of these afterwards and just share them on the
Absolutely.
Reach page if that would be okay.
Yes, yeah. And if there's questions after this, I'm putting the Reach email in the chat. You can always send questions there, and we will make sure Heather, Colin, our admissions team, anybody that's appropriate will get those questions answered for you. Thank you, everybody, for joining us today. Thank you, Heather and Colin.
Yeah.
Information.
Absolutely. Thanks for participating, everyone.